Good afternoon, and welcome to the Flint Community Webinar on Coronavirus. Believe it or not, we are here, week 106 of this community webinar, brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. Our goal with this webinar is to bring to you a local context to the global pandemic. And we know things are shifting, but we are still in this conversation. I'm delighted today to be your moderator, Yvonne Lewis, one of the co-directors of the Healthy Flint Research Coordinating Center. Among the other things that we're doing in this community, we want to make sure that we are providing for you credible and trusted information from the community partners that are doing so much work to keep us all informed. During these weeks, we've had representation from across this community, the county, and even representation from the state. Our partners continue to join us on a weekly basis to make sure that we can effectively provide this information. So we want to give kudos again to all of our partners that join us every week. Today, we have a special session for you. We're going to be looking at the EPA. We have representative. Our special guest today is Diane Russell from the EPA about the Flint water emergency. What happened a little bit a while ago, and it's been a few years now. What's going on now, and what will we be able to anticipate? We're also going to give you some updates from the Genesee Health System. New opportunity for us to share our voice. And as always, we'll hear city updates and then an update from the Genesee County Health Department. As I mentioned to you as we started, we have been here now 106 weeks. And somebody asked me the other day, will we keep going? And that's going to be up to you to help make sure we know which direction that we need to take. But today, we want to just take a few minutes as we start this conversation today and invite a couple of our panelists who join us every week. We see Dr. Hackard. Dr. Hackard, unfortunately, we are still in the midst of the pandemic. I understand things are around the world. In some places, they're easing up, but there are some definite changes. We've had some changes in the metrics that CDC has given us, some recommendation changes, but we cannot forget that we are still in the midst of a pandemic. I know it's springtime. People want to get out and about, enjoy the world. But I wanted to have you talk to us a little bit about where we started last week, just keeping in mind the importance of exercising the abundance of caution.
Yes, and I am just pulling up our most recent state numbers. We'll go back to where I am at. And, Genesee County has done the community proud. Like they're really, still doing quite well. We now are showing a little bit of increase for, say, like Washtenaw or Traverse City, but Genesee County still has, according to the new ones, is still low. And pull up exactly our numbers, but and what does that say to me? That to me is saying that we know our vaccine numbers need to be higher. Our vaccine numbers are not high enough really to protect us all. But what we are doing then is social distancing and wearing masks when we need to, because our numbers are looking quite good. They're down to 39 weekly cases per 100,000. And if you recall, nearly, 2 months ago, we were at 1,600. There was a couple times we were at 1,600. There were many, many weeks that we were above 1,000. Now we are down to under 40. So kudos to every single one of all of you, and congratulations to our community, because we are showing that there are other ways you can protect yourself besides the vaccines. However, those vaccines are safe and they are effective at preventing deaths and severe illness. And so this is our recovery time. And remember that I personally think that's a little bit of an unfortunate name. We do want to let ourselves mentally recover, but really what we need to be doing is preparing ourselves. And when you were saying exercise, I thought, good job, Yvonne. That is exactly what we need to be doing. So we do need to exercise, because exercise is one of the key things to getting your immune system up. Exercising outside is particularly good because the sunlight is helpful. It also will help pick you up mentally out of the 2 years of COVID. We all need a little bit of that. And so exercise is one of the best things you can be doing right now. And so in theory, we should be having spring and we should be able to get outside and exercise. And I encourage everyone to do that. But I also encourage people to wear your mask if you're near others that you don't know. And it's like, well, am I doing that? I am going into a store with my mask in my outside purse pocket. And if I am not nearby anyone, I am not wearing a mask at the moment. Yet when I get in line to check out, I put my mask on. And I put it on for consideration of others. I put it on for the consideration of the cashiers and for people who are around me.
So this is really important. It's interesting how we can use these words in so many interchanging ways as we're exercising the abundance of caution, making sure that we're doing those things that are necessary for us to keep ourselves safe. We're also helping to keep others in our community safe. So as you're looking at this, Dr. Hackard, as our health officer, and I know that things are changing, you know, it's mentioned that we may have some highs and lows. So when we're thinking about it, how would you help us prepare? There might be potentially, as spring breaks are happening, another surge. So what are those tips you want us to keep in our minds? I like the idea of always keeping a mask handy in the event that. What are some of the other things you would want us to even share with others in our community?
Well, there are some things we need to do that take a bit longer. And that's exactly what you want to be doing right now in this recovery phase when our numbers are low. And I do encourage everyone to ask their doctors to run a vitamin D test, because you want to know if your vitamin D is low, and it does take, a couple months usually to get it up to where it needs to be protective of your respiratory system. So it's thought to be, if you have vitamin D above a level of 30, it's thought to be about a 30% protective, whether it's a adenovirus type of cold, whether it's influenza, whether it's COVID, it does protect us. But when you're in the middle of a pandemic, you don't have the luxury of trying to build your immune system, because it takes that, you have to do the things that will protect you at that time. But right now we're at the start of spring. We can start to do the exercise. And when I say exercise, you don't have to break a sweat. I am not a big fan of breaking a sweat. So try and get out 3 10-minute walks a day will actually put you probably, unless you're already incredibly fit, it will put you at the moderate exercise level. You want to make sure you're getting 100 minutes a week, 150 minutes, 150 minutes a week. And that will actually start to boost your immune system. So it's those kind of things that we want to look at, and things that do take a little bit longer, but those are things we can do right now while it's low and safe. And I think that is key. But then really importantly, each person now is their own, each person who has been vaccinated really needs to reach out to someone who they think may not be vaccinated and start that conversation of saying, I'm so glad the numbers are down, but are you, have you thought about more about why you feel reluctant to get the vaccine? I did, because we really need to have that conversation. There's no more messages that public health can do at this moment to get more people vaccinated. We've said everything that people are willing to hear. And so we know the conversations need to be between a person and their nurse, or a person and their doctor, or a person and their friend and their family. That is really huge. And you don't need to convince someone that first day, just ask,
So that's it. So these are our individual choices that make a collective choice that ultimately, and we're going to hear more about this, what solutions we have. And as you said earlier, we want to credit all of our organizations, our community members that have also been, and we haven't all been called first responders, but in some cases, if we think about it, we have been the first voice that someone has heard from with respect to some of these issues. So as this thing is shifting and we're not hearing it in the popular news, we want to encourage us as a community to continue to share these very, very important messages. So thank you, Dr. Hackard, for being on the front line for us. Yes, ma'am.
Can I take one more minute to give something that I think is very helpful? If you hear someone say, well, like the risk to children is still very low, we vaccinate, most people have had their children vaccinated for chickenpox. And if So the last time at the Board of Health meeting, someone said, can you please do as the Surgeon General of Florida is doing and not recommend vaccines for children? Yet even the Surgeon General in Florida is saying, well, the fatality rate is very low for children. It's only like 2.3 to 6.5 or 8.5 per 100,000. It's like, to me, that's still high. We can prevent that. We can prevent all those deaths probably. And we vaccinate children for chickenpox. We do it to protect others, to protect that child, to prevent long-term kind of chickenpox things such as shingles. And the fatality for children of chickenpox is 1 in 100,000. So at minimum, COVID is 2.5 times, but maybe as much as 8.5 times more fatal, causing more deaths than chickenpox. And we vaccinate for chickenpox. So please, everyone think about that. Our numbers are very low for children.
Thank you. And you just hit on something. I know Dr. Wolfe is now chomping at the bit as a pediatrician, but I want to just key in again, reminding us, you said prevention is key, getting our immune system up. And we've talked about that, getting our immune system by checking your vitamin D. And Dr. Susan has also done a wonderful vitamin D presentation for us before. And so Dr. Wolfe, thank you, Dr. Hackard. Dr. Wolfe, you're as a pediatrician, I know you want to say something about that, but also the context of we talked about a local context for a global pandemic. There's some things that are happening globally that we do need to pay attention to locally.
Thank you so much, Yvonne. Absolutely. It's so important to think about how this virus is affecting the world, because it can give us a chance to think about what will happen here. So we saw that the Delta virus started first in South Africa. It didn't take very long for it to get here and then become the most prevalent variant that we had to deal with. And then we saw Omicron started elsewhere and then made its way here. So we can see that by looking abroad, we can prepare ourselves for what might happen here. So let's ask ourselves, what is happening abroad? At the moment, I pay a lot of attention, as you might imagine, to things that happen in England because I have lots of family there and I'm concerned about what's happening to them. And so looking there, we see that they now have one of the variants of Omicron. They have that B2 variant. And so they are seeing that their numbers are rising again. So while they had begun to go down and they thought that things were all getting better, and they are now seeing another surge. The interesting thing to note about this is that we've often gotten messaging or received messaging that says that Omicron is less severe than Delta, which is true, but it's more easily transmitted. Right? So it's much, much easier to spread Omicron than it was to spread Delta, and Delta was easier to spread than it was to spread the original COVID-19. So with that, it turns out that more people actually died from Omicron than from Delta. Not because Omicron is more severe, it just affected so many more people that more people had to try and fight it off, and then some of them couldn't, and so therefore they succumbed to it. So that sense of, oh, this is all over, is not really correct, because people were still dying in large numbers from Omicron. Now, we don't know what will happen with this new variant, but we can imagine that it will have a similar effect. The good news, if there is good news, and I think there is good news, the good news is, well, in England, that large numbers of people are vaccinated. And so they are still protected from the very severe impact of COVID. And that's why it's still important here for us to be vaccinated and take all the precautions that Dr. Hackard was just speaking about. And in that regard, I just want to share something that I bought just the other day when I was happened to be in a shop buying baby things for somebody at church. And I saw this little, can you see what it is? What I have in here? That is a mask. It's a mask holder. Who knew these things existed? And so you can put it on your visor in the car, and then you're never without a mask when you need it. So just to say, take the precautions that you can. Make sure the easiest thing to do is the safest thing to do. So have your mask near at hand, have your hand sanitizer near at hand, as Dr. Reynolds, who's not here today, but I feel like I need to say it for him. We have to use our brains to be sure that we can protect ourselves, even as we go through this moment where the numbers are lower, but we know that they're going to very likely increase again.
Thank you, Dr. Wolfe, and our time for the roundtable is up, but you brought something very, very important. We talk about these precautions, talk about the importance of vaccines. Dr. Hackard mentioned the chickenpox vax, and you're now saying, again, encouraging the COVID vaccine. And we know that there's still many people who have concerns. So in a future webinar, we'll talk about some of those concerns, some of the adverse reactions, but the risk factor in why that we need to consider, but also the value and the benefit. So we can't get into all of that today, but we want to thank you, Dr. Wolfe. Thank you, Dr. Hackard, for joining us in the roundtable today. And now we'll go to our special presentation. While we've been talking about COVID, we have still been dealing with the impact and the aftermath and the ongoing experience of the Flint water crisis, as it is so known. Diane Russell, who is a community involvement coordinator from the U.S. Environmental Protection Agency, EPA, has been on the ground here in Flint with us almost from the very beginning. And she's come today to give us a bit of an update on what's happening, where we are, and potentially where we're going. So Diane, we're so happy that you joined us today. And we want to appreciate you for hanging in here for the long haul, because we needed what you've been able to provide for us in this community. And you continue to talk to us on a weekly basis about what EPA is doing. So Diane, please join us and share your perspective from the EPA.
Thank you, Yvonne. Thank you so much for this opportunity to share with all of you today. Just for those of you who have not don't know me or know my agency, and just a brief introduction to what I do and what our agency is all about, and then just kind of go over where we've been and where we're going when it comes to EPA and the water issues that Flint continues to wrangle with. So who is the EPA? The Environmental Protection Agency is a federal agency that whose mission is to protect human health and the environment. And we have a number of divisions within our federal agency that looks at a whole host of things through the lens of our regulatory authorities. So we look at cleanups of hazardous waste sites. We deal with air issues, and also in what happened here in Flint, looking at water issues through the Safe Drinking Water Act and the Lead and Copper Rule, these regulations that are really in place to help provide safe, clean drinking water to people across the country. So we can go to the next slide, and I can tell you a little bit about what my job is. I am not a water engineer. My work is really around taking the science of what our engineers, our scientists do, and not only communicating back to community about what that is like today, but really I find the most rewarding and important piece of my job is taking all that I learn and what I hear from community and bringing it back to our agency so that we can do a better job of implementing our rules and really start working, not having these things happen to community, but really working with community as we go about cleanups or implementing regulations that are under our authorities. So the next slide is, how does this translate for on the ground? My focus is, definitely listening to what community has to say. I can't thank the Flint community enough of the years that I've been involved, how much I have learned, that I've taken, I've given back to agency, I have applied in other places. Most recently, the Benton Harbor water response that EPA was a part of. So taking that information, listening, educating others, communicating, and having opportunities to collaborate. So let's get into the next slide and talk about, the Flint water response. I'll give a little bit of context just so folks here listening today understand how we got involved and how that plays into what I'm able to update you on today. So of course, you all have lived this timeline. specifically the switch to water in 2014, and EPA assembling a task force in our drinking water folks, looking at these issues, taking a look at the data and science, water quality results that were coming in at the time, and they developed a task force to provide understanding with at the time, Michigan Department of Quality in the city of Flint. And then moving to the states of emergency declarations. That was early 2016. And that is when we moved to issuing an emergency order under our regulations. So our regulations allowed us to put in an emergency order to implement corrections that were identified as needed. So with those state of emergencies and that issue of emergency order, I'll go to the next slide, and really this is that implemented an emergency response. A lot of times EPA, we're very familiar with emergency responses. We do a lot of work around hurricane responses. If there's other natural disasters, we'll implement our emergency response framework, and a lot of times work under the FEMA, Federal Emergency Management Agency, to take a role in looking at emergencies through an environmental lens. This emergency in Flint in 2016 was structured a little bit different because it was through the lead agency was Health and Human Services. So this was a health and human service, a health response. And we played a role in that through the Water Quality Task Force. And we ended up with getting teams on the ground to take samples, understand the status of the system, and monitor that over time to see what was going on. And if we go to the next slide, our goals and our objectives really for what we were doing on the ground at that time was to look at lead. Lead was really the driver here. This is the exposure that we were wanting to eliminate because of its potential impacts and its toxicity. In addition to that, we looked at chlorine. Chlorine is a really important component to water chemistry because that's the thing that we use to help monitor and maintain any issues around bacteria. So chlorine is a really important chemical, and making sure we maintain proper levels because it's a Goldilocks zone, if you will. You don't want too much, you don't want too little. You got to have just the right amount of chlorine. And then people were talking about rashes. There was concerns about filters and of course that bacteria piece. So we came in and we brought a number of EPA staff into Flint to conduct a number of studies and collect samples to answer some of these questions. So if you go to the next slide, I wanted to show during that time period, we did get a lot of important data. As time went on, as we collected a number of rounds of in-depth sampling that we did, we could see that the water chemistry was changing. The orthophosphate that was important to add to water systems to manage exposure to lead was starting to come back, where it was removed from when the water was switched to the Flint River. We found that chlorine levels, once very erratic, became stabilized. And we did really the first of its kind filter study in Flint to understand the effectiveness of use of filters in Flint. And all across the board, we were getting some really good results, data that helped our scientists understand that we were definitely headed in the right direction. However, we go to the next slide. All that information, all that good information, it really was challenging to implement it and get folks to really buy in, because it wasn't really about the results. It really was about everything that happened here and the decisions that were made, and people really getting a feel that you care before they care what you know. And if you go to the next slide, really what we've this is a good example of some study that was conducted in 2016, where they asked residents, where do you get your information? And it was clear to us, while we may be helpful, and we did fare a little better than our state counterparts, people were getting information from folks like you that are here in this meeting today. Friends and neighbors, family, church organizations, local folks that they feel like they could trust. So even though EPA was here and we had information and data, we really had an issue of people being able to find that information trustworthy, and understandably, given everything that had happened here. So if you go to the next slide, what obviously we had an issue of maintaining trust and trying to find a way to rebuild that. And the next slide will, the role that I played in all of this was around community engagement. And for typical federal government, how we do these things, especially in emergency responses, we got busy making sure that we were able to get information out. Here's a website, here's a fact sheet. Let's try to find some key organizations to pair with. And what became clear as time went on is that it's not just about the output. It's not about the information that we have available. We have to establish some relationships before, as that study very clearly showed, we have to have relationships here and establish those trust lines in order to have our information received or accepted. So the next slide, we modified the engagement strategy a bit. We plugged in the Red Cross was pretty key in helping develop these community-based organizations around this model that I'm showing on this slide. And EPA participated in that. And it was through that network that we were able to establish these relationships. And then we also brought in staff from our headquarters office to build those relationships as well. And it was the same folks coming back every time. It wasn't a 2-week deployment and then you never saw them again. They were here. We really started to try to build that network and have those relationships long term. Next slide is really just an explanation of what our community engagement strategy was. It was a multi-prong approach that included water support sampling for our staff that was on the ground collecting that. But we were going into people's homes. We needed to make sure that our engagement around that was sensitive and provided information people needed. We conducted direct outreach and engagement. We had speakers bureaus, that grassroots networking that we talked about. We had some open houses and continue to maintain relationships and provide avenues for dialogue, both two-way communication. And then looking where we could to plug in with community resources. Next slide gives a little bit more in depth about our water sampling support. We tried to find third-party scientists to help us with the verification of the information. We coordinated with other agencies to do investigations like around the rash study and try to get information out in ways that people could access with these maps that were interactive, like the one shown here with the dots. The next portion of our community engagement was that direct outreach. We connected with community members. We held open houses. We provided I did nearly 100 speaking engagements, or me and my colleagues did over that time frame, just getting in. And I've gone to several churches in Flint in 2016, and it was a really enriching experience to be able to go where folks gathered and just be available and answer questions. Next slide is some of the resources that we provided. Is in the early days helping provide grants to the School of Public Health in Michigan. They did a What's in Your Water program where they had community come in and learn about their water system. Probably, no one knew the inner workings of how this stuff worked. And then when it came to be something that people had to know, they wanted to learn more about it. And so those avenues were provided. And a number of other educational resources that we continue to try to look for and provide into community. And the next slide goes to where are things today. And I think some of the key things, again, I want to acknowledge for folks, you know, the data is available. We have websites, the state has websites, the city has information available. But it's really about around what you trust and the information you have access to and the transparency on that. So where are things today as it stands scientifically? I will share with you today and where you can get updates and how you can stay safe. In the next slide, this is, and I've shared a lot of links and QR codes for all of you. If you want to look at these pieces in depth, you can certainly do deep dives in every single one of these areas I'm presenting now. But this is the current status of the water system in this graphic format, looking at lead levels and where that lies in conjunction to the regulatory standard. Again, what's actionable under our regulations as a federal agency, and the last round of sampling that they conducted for end of 2021 was bringing that in about 7 parts per billion for lead. Next slide is, understanding and getting up to date on the changes that are happening here. I did forget to mention one of EPA's emergency order. One of the things that it's still in place after all this time. We're nearing the end of all the things that needed to be completed within that order. And one key piece is that emergency backup system. If ever a time Flint needed to have a backup water source, they would never again have to use the Flint River as that emergency backup. So bringing online an emergency backup water source that will always be on the ready in the case of an emergency or something happens to the water system. So that was a key piece of the emergency order. And the city, and this is a link to their website in the area of the progress report, that infrastructure project, along with other infrastructure projects, are updated to the community through their website. So you can keep track of what the status is on those things. And certainly anytime when EPA lifts that emergency order, it's important to know that it doesn't mean EPA goes away. We have in water enforcement staff that will continue to monitor this system and other systems under the Safe Drinking Water Act. And so even though if there was no longer an emergency order, once that's lifted, we still have staff that are continuing to monitor and maintain the good water and maintain water quality for not only the residents of Flint, but across the state and our region 5, which is what EPA are broken up into regions, and then of course translates to nationally. So the next slide is, how do we stay safe? What are we supposed to be doing? What's the recommendations, and how do you continue, as the city has some work to do still on removing lead lines? How do you stay safe? And how do you just overall reduce your exposure to lead? This is a really good graphic that you can use. And I created a link, so if you wanted to download it and share it with anyone in your organizations or places that you work, it gives some ideas of where, in general, sources of lead can be and how you can reduce those exposures. Use cold water for drinking and cooking, making sure you clean out your aerator so any particles that get stuck in there, they get rinsed out. Filters are great at removing lead. We've seen this now in 2 different studies, the filter study we did in Flint, and more recently the filter study that we did in Benton Harbor. But the filters have to be installed correctly and maintained and operated in order to make sure you maximize that safety that filters can provide from lead. Now, and then flushing. What's the story on flushing? Well, we talked about chlorine and the importance of, having chlorine as the tool in your toolbox to, reduce exposures to bacteria that could be in water. And flushing and getting fresh water in your line helps maintain that good level of chlorine and, minimizes that exposure to potential bacteria. So it's good to flush your pipes, especially if your water's been sitting. It's a good practice in Flint and in really any municipal system that has potential, or even if you're, I'm on a well in Genesee County, and it's good practice too, if water's been sitting, to flush it in the morning as much as you can to get that cold, fresh water coming through. And then you know that it's either properly chlorinated or something that hasn't been sitting all night in pipes inside your home. So I wanted to, there's a few resources out there I think that folks would find super useful. This video, number one, it had everything I've just said. It certainly says it better, and it's even shareable. So it's 2 minutes, how you can stay safe, and it gives you all the tips and tricks that you can do to keep you and your family safe. And you know, scan this QR code if you want to know more about how to stay safe from lead. The state of Michigan has, through their state health department, they have some really good resources. Michigan Lead Safe has flyers if you want to know more detail about, well, how do you clean out an aerator? They have flyers on that. And so they also give some tips on proper filter use. So take a look at that website, share it. If you want to know more about how to keep yourself safe from possible exposures to lead, these are really great resources. The next one is, you know, again, more in-depth information from the state of Michigan on drinking water, flyers, resources here. And next slide is a program that you can access through the city of Flint. You know, let's talk about all lead-based paint exposure. And there's programs that are available to no cost to some residents that qualify. You have to put in an application. Here's the website for that. To take a look and see if you can, you know, reduce other lead sources in your home. And I'll close with this, you know, where is EPA? What are we doing in the next slide? Our regional administrator, Deborah, she stopped in and talked to Flint residents this last winter. She just started her job at Region 5, and she's very, you know, wants to stay engaged and understand where the issues continue to be. As we move towards, you know, the emergency order, you know, concluding and getting into long-term monitoring and maintenance of the system, where are people's concerns? What are the resources that we might have that we could bring to the table? And continuing to have that dialogue. And if I see that I had the wrong website in there, but I think the QR code is right, but it's for EPA's epa.gov/Flint if you wanted to stay up to date on EPA and Flint, and what any other projects or programs that we are doing in the city. So that's what I had to share with everyone today. And you know, certainly I'm local. I live in the county. We have an office. Pre-COVID, I staffed. We'll get eventually back in there at Kettering University's Innovation Center, 1300 Bluff Street. So happy to continue to be a resource to Flint community. And if you're, you know, looking also to facilitate connections with other programs within EPA, I can certainly help guide you there. So
Thank you so much, Diane. It was really important that you said you are a resident of Genesee County. So it wasn't a far leap for you to come over and be a part of what's happening in Flint. So we appreciate that. And as I said, you've been here for the long haul. And you mentioned Flint was a leader in having so many things change for not only our community, but for communities as well. Benton Harbor benefited, and other communities across this nation are benefiting from the Flint experience. And when you mentioned other EPA programs, EPA Regional is looking at doing some work here in Flint with respect to indoor air quality and outdoor air quality. So those are things that continue to come up. Yes. Water crisis, not over. And you mentioned maybe the emergency declaration might end soon, but the work will still continue. So let me just say again, thank you. And everybody knows how important their voice is because their voices has helped us keep you here for this time. So any final comment, Diane?
I just can't say enough to the work that Flint community members like yourselves and the folks on this call have done to move people to recovery. And I am so very grateful to everyone that I've worked with over the years on this issue, on other issues. I'm humbled that you've taught me so much. In my rest of my work in Michigan, I work at a lot of Superfund sites. So these are hazardous waste sites that are dealing with cleanups and legacy contamination. And I've taken a lot that I've learned from community members in Flint. You are the teachers. And I take that forward and integrate that in my work across the state. And it certainly, as I got on the ground in Benton Harbor, and certainly intersected with a number of people in Flint working on that issue. And it's so wonderful to be able to take these lessons learned and apply them in other places. So thank you. And
thank you, Diane. You gave us a great segue when you talk about the importance of community voice, because one other organization in our community that has been a participant on this call, on this webinar for almost all of the weeks is the Genesee Health System. And we know the Genesee Health System has been our community mental health agency for as long as I've been in Flint. So Katie Baxter is here with us today, and she wants to give us a little bit of insights about some programming, but most importantly, to help you understand how important your voice is to what's coming next for the Genesee Health System. Welcome, Katie.
Thank you, Yvonne. Thank you for having Genesee Health System. Always happy to be here. One of the things I want to say, we do have some things to share with you, and we do have a survey. We're going to ask community members to give your voice and hear from your perspective of what you think are some of the needs in the community. But before we do that, I just want to say a couple things that about the pandemic, that this has been a very difficult time, as we all know, and the state, is saying that we're in a recovery period at this time. That's hopeful news. Numbers are better. We've been talking about that for some time, and we're hoping that continues. We're hopeful about that. At the same time, the impact from the pandemic on our mental health has been very difficult. And we've noticed that in our own communities with larger numbers of individuals, particularly children and families seeking services at this time. If you look at the national level, it is reported across the nation the increase of mental health needs. So it's so important that we're aware of that issue, that even though things are getting better, we've still been impacted, and we need to acknowledge our mental health and make sure we're taking care of that aspect of our health as well. I want to note something that's important. Many times you may have heard the numbers that they say 1 in 5 individuals have in America have a mental illness, a diagnosable mental illness. And now some of the statistics we're seeing are more like 1 in 3. So we're seeing people with higher rates of depression and anxiety and other kinds of issues come forth. So we do need to be aware of that. We need to be prepared. We need to have good programming. We need to have good prevention programs. And we want to know the community. We want the community to be aware of the services that are available to people, and when people are needing help, to reach out. It's so important. So I want to stress that. I also want to say something about children. We've noticed an increase in children, and there are some studies that have said that issues with depression and anxiety for teens has doubled. When they did some emergency room data, they've seen doubling in teens presenting for depression and anxiety issues. And something unique is we're seeing a tripling increase in children, particularly girls, teen girls, ages 12 to 17, in reporting tics, okay? And those are, involuntary repeated movements or sounds. And that was something that has been, existed for a long time, seen more commonly in boys. than girls at younger ages. So now we're seeing an increase in that with girls. So there's a lot of things that are presenting that we need to be aware of and be on top of to make sure our programming and supports are available to serve children and families. So I want us to keep in mind of that. I was happy to hear about Dr. Hackard and Dr. Wolfe. We're talking about exercise and self-care, exercise and adequate sleep, and the food we're eating, and healthy ways of socializing, and reaching out to people who lift us up and support us. All of these things are important. So we need to do that kind of thing for ourselves and the people that we care about, and also reach out when we need some help. So I just want to put that in there, that little plug for mental health, how important that is. And then I do want to talk about a community survey that we have. If they could put that up on the screen here, that'd be great. Thank you. Periodically, we do a request for information from the community about what the community individuals are seeing related to mental health and behavioral health needs. We did have a large needs assessment, lots of town halls and things related to our millage. So we have some information coming out, and that's been very helpful for us that we've learned from different populations and different needs. But we want to continue to hear from everybody, and we want individuals to have an opportunity to share their voice about what they're seeing. So this is a community survey, and you see it's just 4 questions. So the first question is you know, who are you? You know, you provider mental health, are you a community member? How do you fall into that category? And then what do you see as being the most significant mental health need that is not currently being adequately addressed? We want to hear that because at this time, as you know, the millage was passed last year, and we will start to see some tax-paying dollars, some money come in to provide services. We are largely Medicaid funded and a small amount of other funding, but the millage will allow us to have some flexibility. There's lots of needs and lots of ways we can utilize that, and there's a lot of planning going on right now, but we want to make sure we're hearing from everybody about what you're seeing are the needs. And then it says, number 3, from your perspective, what trends have you identified that GHS should be aware of? Are you seeing trends in your community, in your close-knit group? And based on what you've shared, could you identify priorities? Because we always have to look at priorities. We have a limited amount of dollars to address all these needs. So what are the highest priorities? So we want to hear that from you. So we'll make sure that link's available for you, and it is open through the end of this month to complete that survey through the 31st. Yeah. So thank you very much for that. I want to add something else. I see that Bill Dobb put in the chat about grief and loss, and Genesee County has been particularly hard hit with grief and loss of many of our own individuals that we've lost, family members, community members. And so grief and loss is an ongoing issue, and the grief process takes time. It isn't something that we go through real quickly and it's over. It's something that takes time. So it's important that we address that and get the support we need. We do have some, all of the regular services we have our regular crisis hotline number. We want to make sure we'll probably put that up because we always put that up so you know how to access us if you're experiencing a crisis or somebody you know. But I just want to highlight some of the grief and loss support groups that we have available right now. And I think we have a flyer we can put up there.
Right. Katie,
so
I think we're gonna
see that.
I think we got a note from one of your staff that they're gonna come in a couple weeks and go over that in more depth with us.
Okay.
So, yep. So we will be looking forward to hearing more about that. So we have a little bit more time to cover that in a future webinar.
Okay, that sounds good. We'll do that. And then I want to introduce Elizabeth Birch, who's going to give some updates about our Neurodevelopmental Center of Excellence. Thank you so much.
Thank you so much, Katie. And yes, Elizabeth, we got a couple minutes if you tell us a little bit about that and what's coming with the Neurodevelopment Center.
Sure, no problem. Thanks, Yvonne. Thanks for everyone who's here today and listening and participating. This is just an amazing, amazing thing that is for our community. I just wanted to give a brief update on the Neurodevelopmental Center for Excellence. This is a department that provides neuropsychological testing for children who were impacted by the water crisis, and also does autism testing as well. But I want to focus on the neuropsych testing for children who are impacted by the Flint water crisis. I want to encourage everybody out there to, whether or not your child is exhibiting concerning behaviors or issues at school or any of that, it doesn't matter. This is a resource that is available for everyone, every child who was impacted by the Flint water crisis. It doesn't matter if you've moved out of Flint, you've moved out of Genesee County. There is a little bit different process depending on what your insurance situation is. However, we are able to accommodate and do this testing. It is a lengthy process, but it's really worth it to really understand your specific child's needs and help. We can help with advocating in the school or advocating wherever to really talk about your child's individual needs. This is a resource we really want to be utilized. We're very fortunate to have it. This is not something that is offered, often. So the phone number is there. Please call us if your child has already been evaluated. There are reevaluation recommendations as well. So sometimes those are 1 year, sometimes those are 3 years. But if you have already had your child evaluated, check those recommendations or give us a call, because we want to do those reevaluations to see if there's been progress made or there's changes. Again, this is something that is very unique and specialized, and we want to make sure that the community is aware of it and that the community has access to it as well. Thank you, Yvonne.
Thank you, Elizabeth. And we know this has been an important conversation in the community, and many people wanted to have some information. So thank you for that insight. Want to go quickly now to the Genesee County Health Department. Joanne Herman is going to join us via phone as we put up the sites for our testing and our vaccination sites. Joanne is currently in a clinic. So Joanne's joined us by phone. Joanne, thanks for joining us. You're still on mute, Joanne. I see you walking around in that clinic. Okay.
Okay, there we go.
You
Sorry about that,
Yeah.
Yvonne.
So
Yes.
Joanne, can you just give us a sense of what's happening? We've got up on the screen our vaccination clinics that are every week, but give us a sense of what's going on, and we'll just run these quickly through the slides on the screen.
Sure. So we continue to stay at our core churches on every twice a month basis. We just moved to that new schedule based on availability of and demand. This morning we were out in Flushing at a senior citizen home. We probably did about 40 people, which was excellent. And we had first time doses, second time doses, and lots of booster doses. So it was really heartwarming. We're at a very large complex today. We just moved over on the corner of Saginaw and Robert T. Longway, River Village. And next week we'll be heading on Monday with Michigan United partnering. And on Wednesday, we are going to be at Catholic Charities. They're having a resource day. So we are out in the community. The following week will be our rotation again with our churches. So we're trying to go where people are at and where the need is. And we have a whole team of people doing homebound visits on a regular basis as well.
Thank you, Joanne. And we know that in addition to what you're doing in the homebound work, that our regular pharmacies are still giving vaccines, and some are doing testing, as well as Hamilton Community Health Network. So
Correct.
just as was said earlier, we know that things are shifting, but we also want to make sure our community stays safe by getting tested. And when you are eligible and you want to have a location that you can access to get vaccines. So thank you for taking that few minutes out for us, Joanne. We appreciate it. Mary Catherine, give us a quick update.
Hi, yes, Yvonne. Okay, hi everybody. Always good to be with you guys. Cases did decrease again this week in Genesee County by about 42% and are back down in Flint about 45%, which was after we had seen that little uptake from the 2 cases last week. So our testing positivity rate is also down slightly, but it's still down, right? And so we are now at about 4.3% as opposed to 4.6%. I do just want to point out that the state is still at a solid 3% for positivity rate. So in Genesee County, we really need to keep up with our vaccine efforts and bear the responsibility of protecting ourselves and others with proven public health measures. So while we keep celebrating the good news, we need to keep other facts in mind. So it's a fact that there were over 1,500 new COVID cases between Monday and Tuesday of this week and 95 deaths before Wednesday. So thank you, Dr. Hackard, for demonstrating this earlier and bringing up those communities in the states where we are seeing increases. Because it's really critical to keep an eye on what's changing for our neighbors and our neighbors' neighbors so that we can be prepared, to respond should our community be impacted.
Thank you so much, Mary Catherine. I appreciate it that we are doing a great job here, and we want to continue to be mindful. Lottie, there are some things that are happening in the city of Flint. We have a couple minutes for you to give us an update.
There are some great things happening, but I'd like to continue today's overarching theme of lead remediation and reducing lead exposure by reminding people about the city's lead-based paint hazard control program. Thanks, Diane, for mentioning that earlier today. We have funds available for residents of the city of Flint whose homes were built before 1978 and have children that are living in those homes. Even if you're a grandparent and you have a kid that's only there for like an hour a week, still contact us to apply for the program. We've got to get 70 houses done before September, and then we've received a second grant to do 70 more houses. Even if you don't think you're eligible, if maybe you've got some delinquent taxes or you've not been able to pay your water bill and you think that you might be ineligible, call us anyway. We can help you with some of those eligibility requirements. We want everybody to have the least amount of lead exposure possible. And so we've done a lot of work on water, and now we need the focus to be on making sure that we remove lead from homes and from the air.
Thank you so much, Lottie. And while you're right there, Lottie, we also want to say that the Water Advisory Committee,
Water System Advisory Council.
Yeah, that council is up and running. We had our meeting on Monday, and thanks to those citizens, we only had a few, but thanks to those citizens that came out to lend their voices there as well. And you as a city, you're working with the partners to also do some additional clinics. So we want to, again, make sure we're working on all these issues at the same time. Let's make sure we're doing what we need to do to be safe. Thanks, Lottie. Appreciate your support and your input from the city. As we prepare to close today, it has been a full day today. We thank all of you for joining us for the Healthy Flint Research Coordinating Center's community webinar. We just want to remind you again, those of you that are receiving the social work credits, take that few minutes immediately following the webinar. When you close out, wait for that survey to come up so that you can be eligible for those credits. You must wait for that survey, complete that survey so that your information goes in as you register, and use the email that you registered for with the webinar. That is going to be so important for you to get those credits. We know you want them. Same for community continuing education units. Please remember, for those of you that are community health workers, fill out that form so that you can get your continuing education units. The webinar team, HFRCC, has also asked you to complete that survey. It's going to still be available for you if you go in. If you received that email already about the survey, please go in and complete that survey, because this is, again, where your voice counts. Do we continue? Has it been valuable? What do you think we should continue to share? Thank you for putting your comments and questions into the Q&A today. We will respond to those, and a couple of those, we're going to bring information back to you in the next couple of weeks. It's been a great day. I hope all of you are enjoying spring. We want to continue to ask you to like us on Facebook, subscribe to our YouTube channel, Healthy Flint. Email us at any time at info@hfrcc.org, and some of you have. And then also give us a call at 810-835-2130. And just in case you are not aware, we will be back here next week for session 107. Thank you for joining us today for the Healthy Flint Research Coordinating Center's Flint Community Webinar on coronavirus.